As COVID continues to spread, there is another respiratory illness that's also increasing, and it has doctors sounding the alarm about a decline in vaccinations.
Health reporter Stephanie Stahl joins us now with more on how to protect you and your family.
That's right, another one to tell you about, guys. Cases of whooping cough are spreading, and it starts out kind of like a cold, but then it turns into a potentially dangerous cough.
I was upset. I was worried.
Juliet Osborne, who lives in South Jersey, talking about her 10-year-old daughter with special needs, recently diagnosed with pertussis, commonly called whooping cough.
She coughed, I want to say, from 4 a.m. until 8 a.m.
Must have been scary.
Very, very scary.
Imani, who's vaccinated, was treated with antibiotics, and so were all her close contacts as a precaution.
It could have been anywhere that she could have gotten it from.
Doctors say the sound of whooping cough is distinctive, and now the contagious bacterial infection is spreading rapidly. The CDC says it's 3 times higher this year than last, nationally and locally.
The cough is severe. You can get fractured ribs, collapsed lungs, all sorts of complications from it.
Dr. Jeffrey Polanski with Virtua Health says symptoms are like having a cold with the classic cough.
And it is in the community and affects both vaccinated and unvaccinated individuals.
The CDC has issued a call to action on whooping cough because vaccination rates have declined to their lowest level in decades. The DTaP vaccine is given to children. There's a different version for adults that also covers tetanus. So adults need to be updated on their vaccines for this.
Yes. Yeah, it's one that is recommended to update every 10 years.
Doctors say people who are vaccinated are much less likely to get infected. Juliet wants people to understand the potential dangers of whooping cough, hoping more get vaccinated. And doctors say whooping cough can be especially dangerous for babies, pregnant women, and people with respiratory issues. So vaccines, very important, and adults, every 10 years you need to be updated. So it's a good thing to check on.
Yes, and it goes a long way to awareness. That's good. Thank you, Stephanie.